Hi everyone, my name is Erica Mogilevsky and my infomercial will be on caffeine. So what is caffeine, you might ask? Caffeine is a crystalline compound that is found especially in tea and coffee plants and is a stimulant of the central nervous system. In addition to our tri-weekly Starbucks caramel frappuccinos, people all over the world have enjoyed caffeine for thousands of years, and it's one of the most studied ingredients in the food supply industry. Caffeine can be found in many forms and is an important aspect of various cultures around the world. Let's dive into the history of caffeine. The use of caffeine dates back to as far as 2737 BC. The Chinese would make tea using tea leaves. In 575 AD, coffee had originated from Africa. In the 11th century, the Arabians consumed coffee beverages. In 1519, the Aztecs introduced chocolate to Spanish explorers, and the very first caffeinated soft drinks were introduced to us in the 1880s. Now for some caffeine content. Caffeine in moderation is considered to be 300 milligrams, which is equivalent to 3 8-ounce cups of coffee. Caffeine content varies within different types of beverages, from teas to coffees to soft drinks and to certain food ingredients. The average intake for adults is 106 to 107 milligrams per day. Coffee and soft drinks are the primary source of caffeine for adults ages 25 and older, and coffee for older adults ages 65 and older. The amount of actual caffeine in a consumable product varies and is contingent upon the serving size, the type of product, and the preparation method being used. An example would be a more robust coffee bean, which is more concentrated and has a higher caffeine content. With this information, you might be wondering about how caffeine actually does work. Caffeine works by stimulating our central nervous system, the CNS, stimulating our muscles and our blood pressure. Caffeine is capable of raising someone's blood pressure, but does not have that effect on them if they are immune to it because they consume caffeine too frequently. Caffeine can also act as a diuretic and increase urine flow unless someone is desensitized to its effects. So what is caffeine used for? Caffeine is mostly used to improve our mental alertness. Caffeine is consumed orally or rectally in combination with various painkillers such as aspirin, acetaminophen, and ergotamine. Other uses include being ingested in combination with painkillers for headache treatment. Caffeine is known to be used for asthma, gallbladder disease, ADHD, which is attention deficit hyperactivity disorder, shortness of breath in newborns, weight loss, type 2 diabetes, as well as low blood pressure. An example of common misuse of caffeine is when it's consumed in copious doses in combination with ephedrine as an alternative to illegal stimulants. A combination of ephedrine with caffeine can result in the nervous system speeding up too rapidly because they're both stimulant drugs. Antibiotics are known to be less effective when consumed with caffeine. There are, however, several benefits of consuming caffeine. Those who do drink it regularly have significantly lower risks of developing Alzheimer's and dementia. The suicide rate in individuals cuts down to 45%. While drinking coffee, you might also experience higher energy levels. As with any psychoactive drug, there are also risks associated with excess consumption of caffeine. Some of the risks include a rapid heartbeat, which can pose as a serious threat to someone with a pre-existing heart condition, muscle aches, diarrhea, fertility issues, pregnancy issues, confusion, headaches, irritability, nausea and vomiting, and jitters. So it's always important to consider only consuming caffeine in moderation. Thank you so much.